I am Kate Menning, Field Services Manager for the Safe Routes to School National Partnership, and I will be your facilitator today for the 2017 Shared Use Ambassadors Best Practices in Shared Use webinar today. Just a little bit about the National Partnership. We offer a depth of expertise, a national support network, and the know-how to make communities and schools safer, healthier, and more active for everyone. Also, a few housekeeping items on GoTo before we get started. On the left is the GoToWebinar viewer, where you can see today's presentation. And to the right is the control panel, where you can raise your hand, ask questions, and select your audio mode. Please note that the control panel will automatically collapse when it is not in use. So if you want to have it open at all times, click the View menu at the top and uncheck Auto Hide Control Panel. There are also two ways for you to listen to us today, either through your telephone or through your computer's mic and speakers. So if you're having issues with one option, I encourage you to try the other one. If you're still having problems, send us a message in chat and we will do our best to field those issues. Everyone today is also on mute, but we definitely want to hear your input and questions for today's panelists. So you can use the questions box to ask speakers questions for the Q&A portion at any time during the webinar. So feel free to populate your questions as you think of them. We'll try to answer as many of those as we can by the end of the webinar time in the order that they are received. So on to our topic for today. Shared use, which is also called joint use or community use in some areas, refers to two or more entities sharing indoor or outdoor space for recreational activity. Shared use is most often implemented with schools or with community centers, parks, and other community facilities such as pools, athletic fields, libraries, and senior centers. But it can also be implemented at faith-based facilities and properties, civic and neighborhood associations, and even at businesses. The purpose is to provide community access to recreational opportunities where none are found, where standalone or traditional facilities are unavailable, and to serve community populations that have little or no access to other recreational options. Shared use support is advanced at the national level by the American Heart Association and the Robert Wood Johnson Foundation through Voices for Healthy Kids, which aims to help all children achieve a healthy weight through policy change, community engagement, and local action to ensure that the places where our children live, learn, and play can make the healthy choice the easy choice. The Safe Routes to School National Partnership currently receives funding from Voices to facilitate the National Shared Use Task Force, a coalition of national, regional, and state organizations dedicated to the advancement of shared use policy and programs, including the National Shared Use Clearinghouse, National Shared Use Resolution, and to promote shared use best practices, success, new approaches, and partnerships through webinars such as this, as well as peer sharing, blog posts, and social media. We'd like to thank the American Heart Association and Robert Wood Johnson Foundation for their support. The task force also developed the Shared Use Ambassador Program, which acknowledges practitioners, researchers, and policymakers who are making positive strides in the field of shared use to increase physical activity and healthy food access in our communities. In 2017, 3 ambassadorships were awarded, 2 to the individuals that we're going to hear from on today's webinar, and our very first organizational ambassador, whose program will be highlighted on the webinar this September 27th, and there will be more information at the end of the webinar on that. So today we have a really great lineup of speakers. Our first speaker is Ruth Bell. She is a health program analyst at the Los Angeles County Department of Public Health, Division of Chronic Disease and Injury Prevention. She coordinates the Joint Shared Use Moving People to Play Task Force, or JUMP for short, and sits on the JUMP Steering Committee. With a background in exercise science, this former fitness instructor realized the need to go beyond individual-level physical activity promotion and engage stakeholders at the community level. She has a special interest in working with under-resourced communities, and at the core of her work, Ruth promotes strategies that can increase access to safe places for play and recreation through shared use partnerships and policy adoption. Our second speaker today is Erika Hood, who works at Case Western Reserve University's Prevention Research Center for Healthy Neighborhoods as a Community Health Engagement Coordinator and Active Living Strategy Coordinator for the HIP Cuyahoga REACH Grant. Erika was tasked with advancing shared use policies in 6 priority neighborhoods in Cleveland and the city of East Cleveland. Through relationship building and consulting with residents, she worked to develop shared use policies at various neighborhood sites, such as churches, community centers, schools, and settlement houses. Her community engagement approach focuses on consulting with a team of experts, the residents, allowing her to implement strategies designed by the residents of the community. Her philosophy is to, quote, understand that residents with a passion to uplift and truly heal their communities are the missing element at many planning tables. So without further ado, we are going to hear from Ruth Bell with Los Angeles County Department of Public Health. Thank you.
Hello, am I on? Good morning, everyone. This is Ruth Bell. I am a policy analyst at the LA County Department of Public Health. Thank you all so much for joining us today on the webinar, and I'd like to thank Safe Routes to School National Partnership for continuing to champion joint and shared use strategies as a way to expand physical activity access. I'm very humbled by this nomination, and I really thank you guys for being with us today. I'd like to share a little bit about Los Angeles County for those of you who may not be as familiar with LA. The Los Angeles County is about 4,000 square miles. It's a really big county. It's the most populous county in the U.S. There are about 10 million people living in LA. There are over 200 languages spoken here. But with all that, there is still about 41% of the population that's at or below 200% of the federal poverty level. So as you can see with the places in red, and I'll get to explain those more, we have very high need in LA County. There are over 88 incorporated cities, 140 unincorporated areas. We have 2 islands. We have suburban, urban, rural communities, beach communities, mountains, valleys, and we have a national forest, as you can see in green on the higher end of the map. With all of this land, though, we have about 3.3 acres of park space per 1,000 residents. Even with this kind of good acreage of park space. Countywide, about 80% of our parks have less than 3.3 acres per 1,000 for residents. So if you notice on the map, I'm going to kind of clarify it a little. The green areas in kind of the middle of the map here and on the top are the Angeles National Forest. No one lives in the forest. Everyone lives down here where it's orange and red and light green. LA County has very densely populated communities, and we are in very high need for parks, and I'll explain a little bit more about that later. The lack of adequate park space is a public health problem. The solution, though, could have a multi-benefit effect, anywhere from social justice to health, equity, housing, social cohesion, if we had more parks. In 2009, brainstorming began between one of our largest school districts, that's LA Unified School District, along with Prevention Institute and the LA County Department of Public Health, and we formed this group, JUMP, Joint Use Moving People to Play. This task force was originally started under the Communities Putting Prevention to Work, or CPPW grant. We decided to work with schools. We have 80 independent school districts. One of the school districts is the second largest in the US, which is the Los Angeles Unified School District, or LAUSD. There are about 900 campuses in LA Unified, and all of the students in LA Unified make up about a third of all the students in the county. So we have 80 independent school districts, but one of those school districts make up a third of all the students in the county, just to give you some context. So we worked with LA Unified in 2009 under the CPPW grant, and after that grant sunset, the Joint Use Moving People to Play, or JUMP task force, decided to stay together. We had no grant. We had just a little bit of grant for money for staff, but no clear direction. So we decided we need to reinvigorate ourselves. We developed a strategic plan with a 2-year action plan, and we are now in the implementation of it. We're about to start year 3 of implementation of our 5-year strategic plan. The vision and mission of JUMP still remains the same, and that is to ensure that all LA residents have access to safe places to be active and to be well by encouraging the formation of partnerships. One of the lessons that we learned in the earlier version of JUMP was that if the land's not ready for the seed to be planted on, the seed won't flourish or the seed won't grow. So we were successful in the earlier versions of JUMP of having joint and shared use agreements and policies implemented, but they did not last, or they weren't as strong as they could have been. So the exciting thing about this initiative is that it's not new work. What we're doing is informing and helping how professionals approach their work. We're providing tools and resources and networking opportunities to influence decision makers to move towards a collaborative model that leads to better health outcomes. So JUMP is very inclusive of what we consider to be joint and shared use. Because of our kind of broad definition of joint use or shared use, and as Kate mentioned earlier, also known as community use, there's something that still kind of blocks success, and that's liability and maintenance. It's the big elephant that's usually in the room when folks try to engage into partnership conversations. One of the challenges that we realize also is that folks are more afraid of what they don't know, more afraid of letting others in, more afraid of sharing resources, and not realizing what it takes to actually produce a good shared use or joint use agreement. So that's kind of the work that we do in JUMP, is to help to break down some of those barriers, not just the maintenance and liability issue, because that's very well documented, but the negotiation process. How do you actually meet and engage school districts? Are school districts the only owners of land that folks can share with? Should we then also try healthcare systems or faith-based organizations, or even parks that are under-resourced for programming? So over the years, JUMP has kind of changed format. So our past structure, we focused mostly on policy, school-based policies. We focused on brokering joint use agreements. We brought the partners together. We said, sit down and talk, hash out an agreement. They did. We were able to check on the box that we had a certain number of agreements in place. DPH, because of our grant from CPBW, we were able to do a lot of the heavy lifting. We were able to also fund partners to form relationships. Once funding went away and once the heavy lifting of DPH went away, some of the shared use agreements also went away. So our new perspective, what we're doing now is building our internal capacity. Not only are we helping to provide technical assistance to partners who would like to engage in shared use, but we're also building our own internal capacity. And to do that, we have partnered with our evaluation, our DPH evaluation team. So they are producing and researching and producing data points for us to be able to better understand the landscape of shared use in LA County. As I mentioned earlier, LA County, just one school district within the county, has over 900 schools. We did a small project, not small, but we did a research project to kind of get a landscape of what shared use looks like with this particular school district, and it seems like shared use is underreported. So we have now gone back to the drawing board to try to figure out what exactly do all the other sectors like community-based organizations, faith-based organizations, hospital systems, how do they see and view and do shared use? We're also building awareness, not only building awareness in public health or in the park sector, but also building awareness in the community. Our initiative is wanting to go beyond schools and go beyond physical activity to also include gardening and food resources as well. So why shared use? Why do we still need shared use? It's for equity. If you look at this map, we did a park needs assessment in March of 2015. The stars kind of aligned here because in 2015, JUMP also developed a strategic plan. In 2015, our LA County Board of Supervisors decided that they wanted to approve a motion to initiate the countywide comprehensive parks and recreation needs assessment. And this represents an unprecedented effort to document existing parks and recreation facilities in all the cities and unincorporated communities of LA. We use this data to determine the scope, the scale, and location of park needs in LA County. What we found from this needs assessment is that park poverty or park poor locations were not only in under-resourced communities, but affluent communities as well shook out as being red or orange, as you can see on this map. This is a beach community that is fairly affluent, and there are other affluent communities throughout central Los Angeles that also are poor for parks. The park need assessment had several metrics that were looked at, and it was not just poverty level or race and ethnicity, but the condition of the parks, the accessibility to the parks, the population density around each park and the size of the park for the population density. So there are several things that went into this this assessment. From the assessment, though, joint and shared use rose to the surface as something that we now have to do. LA is built out. There's very little to none of vacant property to be able to build new parks. So we have to look to shared use as the new normal. Our joint use or JUMP strategic plan has 3 priority areas. The first is to identify resources so that we can increase community access to spaces for recreation and play. So some of the resources that we have identified comes from Change Lab Solutions, comes from the Safe Routes to School National Partnership, comes from the American Heart Association, and we've also developed our own internal resources which we have on our JUMP website, which I'll share with you later. Another strategy that we have is to communicate and disseminate these best practices, the successes, and even the lessons learned and challenges. Those of you who are new or even vested in joint and shared use knows that it's not without challenges, but it's our only hope, especially here in LA. The last priority is to continue to develop our internal capacity and our resources, JUMP as an organization. So I mentioned that JUMP started under the Renew grant, and now JUMP is living on its own breathing entity. It was started by DPH, and DPH still supports JUMP, but JUMP now has new co-chairs from the school sector and from our Parks and Rec. So the goal of JUMP is to just build awareness. We want to build a firm foundation. When we started earlier to build joint and shared use, we just went out and we cast the seeds onto the ground and hoped that they would take. Now we've decided to till the soil. We are creating resources. We are the LA Shared Use Resource Hub. We want to cultivate shared use champions. So folks that are part of JUMP may not all be practicing shared use, but they are still carrying the shared use message. They are championing shared use as the strategy that we need to do in LA County. We meet, we convene, we gather resources, we develop resources, we present, like doing these presentations like webinars that I'm doing now. We are creating reports and briefs, one-pagers, and data. And I'd like to talk a little bit more about the data. In 2013, we did a round of internet panel survey, and in 2016 we did a second round of internet panel survey. And with this second round, we combined mapping approach to geographically to see the geographical distribution of shared use sites, the characteristics of the communities with shared use facilities, and we surveyed respondents' awareness of the sites. This is just a sample of a part of the data. Facilities available at schools that are open to the public for physical activity compared to the general interest in these facilities. So about 419 folks had available facilities, but 800 respondents were very interested in using these facilities. And if you notice, the multi-purpose room was one that people were most interested in using, but had the least access to be able to use. So we can use this type of data to help program shared use agreements, to help develop shared use agreements. If we really know what the community wants and has access to, we have a better chance of having some of these agreements stick for the long haul. All of our resources that we've developed are housed on our website, which you see the link at the top of the page. So we focus on five sectors: public health, community-based organizations, the school sector, cities and parks, healthcare, and faith-based organizations. Our accomplishments to date under our newly revised JUMP format is we now have the website which we host. We've developed a GIS shared use mapping tool with the Parks and Rec Department. We're working more strategically to acquire and analyze data. We're right now doing a shared use if environmental scan, and that hopefully will be finished. Data collection will be finished hopefully by the end of this year. We're developing ed briefs. We are deepening our work with Parks and Rec, and we're cultivating shared use champions. Looking ahead, we are hoping to be able to capitalize on the ballot measure that was on our November ballot. In 2016, from the Parks Needs Assessment data, a measure was voted on with 75% voter approval to add a property tax to LA homeowners for parks. We also hope to develop a park prescription program in LA. So those are some of the things that are coming on the horizon for JUMP, to participate in Measure A implementation and to continue to support county-wide park efforts. I can be contacted at the information listed here. And I'm ready for questions during the question and answer section of the webinar. Thank you.
Thank you so much, Ruth. Your program is just very fascinating to me as someone who works on shared use in the state of Ohio. I learned a lot just listening to and I've got a few questions I've got jotted down as well. But before we get to that, before we get to question and answers, we are going to hear from Erika Hood. Erika is the REACH Fellow and Active Living Coordinator at Case Western Reserve, and she's going to tell us about her Ambassador Award program. Take it away.
Hello all, and Kate, thank you so much for the invite today to talk about a program that is near and dear to me and my colleagues in the work that we do. I'm going to talk a little bit about adopting a shared use policy to address the physical inactivity in our under-resourced neighborhoods here in Cleveland, Cuyahoga County. This presentation was made possible with funding from the Centers for Disease Control and Prevention, as well as being a product of a prevention research center. The views expressed do not necessarily reflect the official policies of the Department of Human Services. And with that, let's get started. So some of you may heard Cleveland being referenced as the mistake on the lake, but no longer are we the mistake on the lake. We have championship teams in basketball, hockey, baseball, and of course we have the Cleveland Browns. But we're also a hub for global healthcare innovation, which is exciting. And when we're talking about this topic and health equity, why is this work so important to us in Northeastern Ohio? Being the hub of many high-class and world-class healthcare institutions, we also unfortunately have some of the worst health outcomes in the state of Ohio. So just making that direct link to the services that are offered and the residents who don't always have access to those services. So when Ruth mentioned it before, health equity is a huge issue, and trying to make things more equitable for our communities that are underserved. So back in 2009, in an effort to address this, HIP Cuyahoga was started. I often tell people about HIP Cuyahoga, and I describe it in a way that many of us come to some of the same meetings. You go to a meeting, you work in the field of public health, and you go to a meeting and you see some of the same faces over and over again. So in an effort to kind of come together, HIP Cuyahoga embarked on this process called the Health Improvement Partnership. The goal was to identify the most pressing issues impacting the health of the county's residents, as well as create a plan for addressing some of those challenges. The collaborative process builds the foundation for all in Cuyahoga County to be healthy. So with this process, it was all kicked off with a mission to target some of these high-hitting issues with some people in the room who can really make an impact. And I'm advancing, one second. There we go. So who sits at the table for HIP Cuyahoga? The consortium now has over 100 organizations that are represented, and we're talking about healthcare institutions, public health, academia, transportation, the faith-based community, grassroots organizations, government agencies, as well as community residents, to name a few. So having everyone in the room with a focus on some targeted issues, it's a better approach to go about the work because everyone is there at the table and we can address issues at the same time. I want to start broad and give you a bit of the background on HIP Cuyahoga so that I can then narrow the focus on the project that I'm working on now. And I think that will make a little bit more sense to you guys. One of the key approaches of HIP Cuyahoga is health and equity in all policies. We touched on this a bit before on why health equity is so important. So we want to build those opportunities for everyone in our county to be healthy and do it in a collaborative way. So as I mentioned before, we're going across all sectors and bringing those folks to the table so we can address some of these issues as far as systems and policies and also barriers to getting the word down to the community members. Also, perspective transformation. So with this approach, the goal is to work with individuals and organizations to help them understand how hidden assumptions about racial and ethnic minorities impact their decisions and actions toward health improvement. I think HIP Cuyahoga was very progressive in asserting that institutional racism has a huge impact on how healthy our residents are in the city of Cleveland per se. The collective impact approach, it allows us to bring everyone together in a structured way. We want to achieve this change together and we coordinate our efforts through a lot of the work that we do by just having everyone at the table and having everyone together in the room. We're able to leverage tons of resources by just being able to send an email or reach out through a call because you now have a relationship with someone at an organization who can now advance the work that you're doing. We can share data, share lessons learned. So it's a very, very good approach and it makes things way more efficient. And lastly, community engagement. Oops. You'll see some pictures to the left. Those are some of our residents that you will learn a bit about more in a few more slides. The goal of this is to go beyond a data-driven approach to a community-driven approach guided by shared values. It's extremely important to involve community members in the planning and decision-making process, and that will make all of our, it will make everything more impactful but also sustainable. So the 4 subcommittees of HIP Cuyahoga are chronic disease management, clinic and public health, eliminating structural racism, and then healthy eating and active living. So out of these 4 subcommittees, you'll see how our project was then developed. The REACH grant is a CDC-funded grant, and it stands for Racial and Ethnic Approaches to Community Health. We received this grant in 2014, and the original goal was to link the clinic to the community, also to address chronic disease by implementing a chronic disease self-management lay leader program to have community members go out and then coach individuals with chronic diseases on how they can manage them. And then also provide access and opportunity for healthy eating through a corner store project and also active living through shared use agreements. As you can see, we have 6 neighborhoods in Cleveland, and then also the city of East Cleveland, which is an inner ring suburb to Cleveland, that were identified as being predominantly African American with considerable health disparities linked to poor nutrition, physical inactivity, and disjointed links to quality healthcare services. So the orange areas on the map are the areas that we work in, and those are on Cleveland's east side. So one of the key components to the REACH grant was involving the residents. And as a community fellow, there were 3 community fellows that started on this project, and we had 7 areas or 6 neighborhoods and then East Cleveland that we were all working with. So our goal was to recruit residents from those areas and ask them to participate in a 10-week health equity and leadership workshop. So through that, we use Neighborhood Leadership Institute, which is a local grassroots organization that empowers residents who are natural leaders and just enhances their leadership ability, and has over 1,200 individuals who have graduated from that program who are now out in their communities making change. So we used that organization because they were well connected to the community and well respected, and we were able to recruit residents for the workshop. The first picture up top is cohort 1, and those were residents from 3 of our neighborhoods in Cleveland. And then the second is cohort 2. When we talk about the shared use strategy specifically, what were our goals and objectives when it came to this strategy with the REACH grant? One of the very first things that we did was we researched the topic. We went to some experts in the field. We utilized Change Lab Solutions. They actually came into Cleveland back in September of 2015 to provide a workshop on shared use, just the one-on-one, the basics of shared use. And we brought tons of community members into the room. You can see the pictures. And we kind of did a shared use one-on-one. We wanted to address some of the questions about shared use, what spaces can be used. We wanted to actually address some of the vocabulary that we use when we talk about shared use to make things more plain and easy to understand, because that was a barrier in itself, truly understanding what shared use was and what it meant. So after bringing folks from settlement homes, community organizations, churches, schools, they all came to the room. We had the background information given to us, and then we were able to ask questions. As a part of this initial effort, we developed a shared use agreement resource guide, which puts all this information into one easy package, and then it gives it a local feel. So in this resource guide, we're talking about areas that are near and dear to us in Cuyahoga County, so we made it a bit more local, and that is available on the website of HIP Cuyahoga as well. So another objective was to secure 22 shared use agreements for each census tract that were in our priority areas. So those 6 neighborhoods in Cleveland, as well as the city of East Cleveland, covered 22 census tracts, and our goal was to secure a shared use agreement for each. And on here I have agreement versus policy because just that language alone created a barrier as we were going out into the community to talk about shared use. I wanted to just pause here and kind of talk about the language that we use when we go out into the community and providing that background information to individuals, because this was a true challenge for us. When we thought about shared use agreements and approached sites about signing or creating a shared use agreement, the issue of legality and having to forward this to their legal consultants and paying for a lawyer to look it over to make sure they wouldn't be held liable. We hit so many barriers because a lot of our organizations are small organizations without the capacity to actually have someone look over documents, especially coming from an organization on a topic that may not be one of their priorities. So we changed it over to policy. We felt that by creating a shared use policy and having them implement this into their policies and procedures manuals and kind of lead how they do rent their spaces out or utilize their spaces in the future, this would be more impactful. So we created the shared use policies, and each policy is tailored to that site. So whether they have a community room, community space, a basement space, an outdoor space, we're able to, a kitchen, we're able to tailor that and make it unique to each site. Whatever wording they are not comfortable with, if they're comfortable with using something else, we sit and we write those with the organizations so that they can feel comfortable now signing this and then implementing this and making it a part of what they do. So this was very important to pull the organizations into this process. So this graphic details a bit about how this process looked. Myself and my two colleagues at the time, we began to look at the layout of Cleveland and the city of East Cleveland and created a database full of churches and schools and community centers and parks, what was out there, what spaces were potentially available. And through that, we drove around and we looked at each space and we kind of cataloged what we had and what we saw. And 44 sites were deemed eligible. And that was by our standards as the practitioners in this work. So what we did is we had this aha moment, like, look, we have these experts here at the table. Let's go to our community health ambassadors, those individuals who were on the picture that you just saw. These were our residents who were ready and willing and who also knew the community. So they then provided us input regarding safety, accessibility, and then the community buy-in for the facilities. We were able to talk more a bit about the spaces that each facility had to offer, as well as if there were water fountains, if there were parking, if they were on public transit lines. So we were able to get more feedback from our community health ambassadors that would have been a bit more challenging for us, not coming specifically from those neighborhoods. So this was extremely important because we were then able to focus our efforts on those spaces that were recommended by our community members. So we approached 44 sites and we told them about this strategy and why this strategy is important to their community as well as their community members. And we asked them to sign a shared use policy. 2 of our sites declined. They weren't at the time ready. They didn't have the capacity. One was honestly a trust issue between us coming in cold, not being the residents or community members. It's a site that I would love to visit again in the future after some of this work takes off a bit more. 12 of the sites are in active follow-up, meaning someone may have been on vacation. We need to follow up with the right person. So we're constantly communicating with those sites to sit down with them. And as you can imagine, these are community sites that are very busy, and they may have, just a few people working, so it can be a bit difficult to get the right person at the right time. 7 of them are currently pending, which means that we have written up a shared use policy draft and we're waiting for it to be approved. So whether it's the tweaking of a word or the addition of another space or opportunity, we're waiting for those to now be finalized and signed. And then we have 23 signed policies at this time. So we met our objective and one more. So this was actually great because this happened within the last month that we hit that target. Some of the challenges in this work that we faced is definitely looking for what does policy enforcement look like? How can we have these organizations now sign on board, but then how do we know if they're actually utilizing the spaces for physical activity needs at low cost or no cost for community members? That was definitely one of the stipulations in the policies when they signed it. We wanted to make sure that if physical activity programming was actually put into the site, that it was accessible to the community members. So how do we then enforce that or monitor that in a way that is actually happening? Also, funding to support the sites. Many times when we talk to our community sites, funding comes up as an issue. They're stretching budgets to make things happen, and for them to take on an additional program that comes with a cost can sometimes be a challenge. So how do we support them or connect them to different resources? Also, administrative support to policyholders. It has come up that some of our sites just need someone to create a flyer. How do we help them rearrange a space to make it more accessible? So just being a go-to organization that they can call on to come in and help them kind of work out some of those kinks when they may not have the capacity to make it happen. Programming is an issue. Finding what programming works best for the community members that they serve, and then also finding a programmer that comes from the community. That would be the best fit, but also finding a programmer that comes with a cost that they can afford. And then lastly, marketing. Many of these sites may have a listserv that they leave flyers in certain places around the community, but how can we broaden that reach and help them market? Many of us are tied to organizations that have hundreds and thousands of people on our listservs, but they may not be the community members that can actually use those sites. So how do we then help them reach those folks? Some of the successes that we've seen so far is that organizations are very eager to collaborate. Many of our organizations have heard by word of mouth that another organization has signed a policy, and then they want to sign a policy. Some of our most difficult policies to get signed were the initial ones, but after we had some of the heavier churches, the larger churches on board, or the larger community centers on board, I would always use that as leverage. Like, hey, you know that so-and-so church signed a policy, and they're like, really? So that helps a lot. And it kind of created this network where if a trusted organization became on board with this strategy, they began to trust it as well. Also, the development of a programming network. So we're currently in the process of creating a database of community programmers. So those community members who now have Zumba certifications, who now do line dancing classes, Tai Chi, Qigong, how can we bring them all together and create a database of their information? How many of them have received grants to do their programs for free? How can we plug those into sites that may not have money for programming? So that is what we're trying to do, and to continue to spread the word so that the community begins to buy into this process. They begin to know what shared use is, what it means, and how it can positively impact their community is what we're trying to do. One of the logos, I had it on a previous slide for HIP Cuyahoga, was Health Matters Here. And it's a beautiful logo that we now use for our corner store project. So many of the windows and doors will have this cling on it that says Health Matters Here, identifying this space as a community space that cares about the community members and their health. And now we're using that cling on our shared use sites as well. So we're beginning to brand this initiative, and it's beginning to grow. I wanted to share a few pictures. These are very important, I think, because it shows that the pictures that we utilize in our marketing and when we go out into the communities to talk about this strategy, they are not stock photos. We use pictures of our community members. The one to the left is of Miss Lean. She's a Zumba instructor who is also one of our community health ambassadors who went through our workshop. So she knows the process. She's been there since the beginning, and she has bought into the process. So now when we plug her into a community site, they see that she comes from the community, and it makes this just go full circle. Up top, we have a group at a community event doing Zumba, and they look super excited. It brought many people out from different areas. Everyone may not have come from that community, but we can all play together. We have drum circles, which is more for mental health. It just allows you to kind of relax and let go of some of the stress of the day. So we try to do programming or find programming that can fit the needs of all community members. If you look to the right, we have a Qigong class that was facilitated by Master Wei. He's in the yellow. And this is important because it introduces new forms of physical activity to our community members. So things that can get them healthy mentally and physically that they may not have tried otherwise. We also received a Vitamix from the Vitamix Corporation, which is great because we can now take the smoothies out to these community events and share with them a delicious recipe for a green smoothie, and hopefully just adding that to their palates as a new taste that they now want to try on their own. And lastly, through the REACH grant, we were able to have a media campaign to reach more community members. And by using our public transportation system, you'll see that the poster on the bus says from cafeteria to Zumba studio. And this shows our collaboration that we have with some of the schools here in Cleveland. Our school district has a shared use or rental policy, but it may be a bit of a barrier for some of our community members because it comes at a cost that's a bit pricey. So we've been working with a network of site coordinators that are at some of our investment schools, and through the work that they do, because they have this holistic approach to serving the children and the families, we're able to work with them and use the spaces during hours that they have access to the building. So we're able to use those community spaces, which we know are important hubs within any neighborhood, and we're able to access those and have our community programmers access those for free. So this is awesome. So what is next? As you can imagine, we have the strategy that is growing now, and many people who may not have come to the original shared use workshop have signed on and want to know more information. So we're going to have next week actually another shared use workshop. We signed a policy now, what? Shared use 2.0, and we're going to bring all of our policyholders into the room. We gave them a survey prior to this workshop so that we can be sure to address those issues and questions that they have regarding funding, regarding marketing, regarding barriers, because their community members may not have transportation to get to their sites. So we are bringing in panelists and experts who can address those specific needs. I want them to leave from this workshop feeling as though they have gained knowledge to address this barrier and make shared use more accessible to their community members. Also, expanding the initiative to organizations outside of the REACH communities. REACH was just a limited area in Cleveland. As you saw, they were predominantly on Cleveland's east side. So now we're able to look at those inner ring suburbs on the east side and then look at some other spaces on the west side of Cleveland. We can now expand this, but we need to be ready and prepared to address those issues and concerns. So it's a continuous learning process and learning from our sites that are doing it well and making sure that we incorporate all of their needs into our workshops and our resources. And then lastly, of course, sustainability. We want to have this wonderful network of community providers, those who facilitate physical activity classes, and then also these shared spaces. So we want to marry those two together. Who needs a facilitator, and what facilitators are looking for spaces, and how can we be the connector of the two? Also, how can we have the individuals that sign these policies now become a network and learn from one another? So what one space may be doing well, they can share with another space. And if there are funding opportunities that they can collaborate on, how can we make that a possibility and have them become a network? And then lastly, making this initiative a priority when writing larger grants. So how can we be responsible for now writing this initiative into larger grants so that we can support these sites, but then also making sure that the sites know enough about shared use and its importance so that they can write it into grants that they now seek, so we can keep this sustainable that way. So that's where we are now. We've had a huge accomplishment to get 23 sites signed on, but then again, there is so much more work to be done. I think with the residents now, they're sitting at the table, they're helping to inform us. We know the barriers, we can hear firsthand what the issues are, so it's easier for us to address those issues moving forward. And that is all for me. Thank you guys so much for listening.
Thank you, Erika. That was a lot of information. I'm going to just go back and show my screen. And we're going to get started right off the bat with some questions that came in during our presentations. I do want to thank Ruth and Erika both for their presentations, and I'm sure they're both unmuted by now so they can answer these live. So our first question is for both of you. It is from Anita Lopez, a program manager for a HEAL initiative in Lemon Grove in the San Diego, California County area. Her question is, could you share more about challenges in activating community once agreements have been made? And also, could you share how you manage your efforts with regards to partner engagement and leadership, internal staffing, and continuous community member recruitment? And we do only have about 5 minutes left on the webinar, so if we could just be brief, we can maybe get to all the questions that we have to answer.
Okay.
So who wants to go first? Erika, you go.
All right, great. That's a great question. Once the sites have been onboarded and we have community members involved, it's just important, I think, to allow those community members to then speak to new community members and recruit more folks. So we're always kind of in the background, and we allow our residents to speak for this initiative because it's important to them. And then that way more residents are trusting of them. They're trusting of this initiative. It's brand new. It's a new concept, but we try to show them that it's not really new. It has been going on, but just the wording that we use. And, you know, I try to tell myself every single time I speak to a community member to act as though I have heard this for the first time and to explain it in a way that's easily to understand. So we allow our community members to help us with that, to ensure that we're speaking to folks and getting getting them excited about it.
I have a slightly different dilemma with our shared use work here, and it's that our community members are a lot less engaged with joint and shared use here in LA and at the level that JUMP works. JUMP works mostly with building capacity and awareness among the potential shared use partners and less so with community members, but that's something that we are hoping to change in the near future with our park prescription program.
Okay. Our next question is specifically for Ruth. How are you considering shared use of golf courses in LA County? Is that a consideration?
It most certainly could be. We have not thought of that yet, but it most certainly could be. I know that there's a First Tee program that we helped to implement in Pasadena Unified School District that was under the original CPPW grant, and I think they did First Tee not necessarily at golf courses but at school sites. But I'm open to any piece of green space that would allow sharing of that space for the community at large.
Okay, great. A question for Erika specifically. How do you deal with a location or site that is not willing to adapt a policy for various reasons, but the need in the surrounding the location is abundant? And great presentation, by the way.
Oh, thank you. That's a great question, and that's something that we're still trying to combat with a few of the declines. One of those is a space that is a beautiful community space, and the residents are like, why can't we secure that? But again, I went into that meeting to approach that site, and I think that we just needed our heavy artillery of having community members to help us convince them that it's a good site, but then also showing how it works well in other areas. So I will continue to provide information and resources to those sites. You can't make them do anything, but again, just showing them that they can offer this, and the impact doesn't have to be as great as they think it is, the work that's put into it. So that's the best thing I can think of.
Okay. And then our last question that we'll have before time, we've got about 1 minute left. What are some of the, quote, outside the box shared use policies? Do either of you have like one example of an unusual or somewhat fun or interesting shared use policy?
I do. One of our spaces is actually a neighborhood cleaners. Connected to the neighborhood cleaners, they have the entire building, and connected to it is a beautiful room that they renovated, and it's a gorgeous space that can be used as a studio. And that is definitely one of our spaces that people always question when they see the cleaners in the name of the policy. So I love that space.
That's awesome.
In LA, we have a space in our Boyle Heights, East LA neighborhood that is a cemetery. The cemetery has a walking trail around it or in it. So that's been used as a recreation space here.
Wow. Okay. Well, thank you both so much for all your, for exploring this opportunity, for sharing your programs. They were wonderful. As a closing, I would like to let our audience know that there are some other ways that you can make a splash in shared use, and I just wanted to use the pool picture, so that's why I have it, the splash there. There's a National Shared Use Resolution sign-on the National Partnerships website. The link is here, and these slides will be available to everyone after the webinar, so you'll be able to use those links. There's also a shared use Google listserv, and that listserv is a space where shared use advocates and practitioners, researchers, and policy influencers can exchange ideas, so you can join the Google listserv. And finally, if you're looking for other ideas or other questions on policy or research, visit the Shared Use Clearinghouse. There are useful tools, resources, data, and information about shared use policy, implementation, and success across the nation. So check out those tools for further exploration of your shared use implementation. I also want to invite you to attend our next Shared Use Ambassador webinar, which will be Wednesday, September 27th at 1 p.m. Eastern, 10 a.m. Pacific time. The Ohio Department of Health's Creating Healthy Communities program is our first organizational ambassador, and they are going to be not only exploring what they are providing at the state level with regards to shared use, but what some of their communities are doing within Ohio to advance shared use in urban and rural communities as well. So registration will open in August. Hope to see you there. Just want to invite you to please take our survey once it is emailed to you after this, after the webinar. We really love to hear your input and to make these webinars as effective and important to you as they are to us when we put them on. So thank you very much for joining us. It's the top of the hour. If you have any questions, please feel free to email any of our speakers or myself or the National Partnership. Thank you.